And we go to our slides and okay, and let us we started speaking about signs and symptoms, and I would like you to analyze the following condition, which is given here on this slide. And we should decide whether these are signs or they are symptoms, or maybe they are both, sign and symptom. So in condition A, let us look at the just phrases which are given here. Blocked nose, raised temperature, tender over sinuses and headache, worse on bending, runny nose. And let us listen to Kumar Ritik. What do you think? Which of them are signs and which of them are symptoms? Can you comment, please?
Yes, ma'am. Ma'am, blocked nose is a sign because it can happen in cold, fever, or etc. In raised temperature is a sign because it is a kind of fever which destroy our antigen in the body, which may be of different disease. We don't know that disease. Tender or sinuses is, I think, a symptoms of a disease. Headache, worse on bending is a symptom. And runny nose is a common sign which everybody faces in different.
Thank you. So we should remember that we should analyze these conditions from the point of view of a doctor or a patient. If it is seen to a patient, this is a symptom. If only doctor notices this is a sign. So the answer is given. Actually, all of them can be considered as symptoms. For example, tender over sinuses may be not seen to a patient. That is why it can be considered as a sign, but also as a symptom. Good. And one more similar task about condition B. And let us listen to, okay, you see here raised pulse, recent vomiting or diarrhea, dehydration, abdominal tenderness, crampy abdominal pain. And let us listen to Mocht Schweib. Is he here? Mocht? No? Okay, minus. Let's go back to Aman.
Yes, ma'am.
Can you
Ma'am, raised pulse is a sign. Recent vomiting or diarrhea is a symptom. Dehydration is a sign. Abdominal tenderness is a symptom. Crampy abdominal pain is a symptom. So 2 and 3 are sign. Okay, fourth one is also sign. Okay.
Good. Because of course patient. I'm not sure about vomiting and diarrhea. I think it's a symptom because this is very visible to
yes, ma'am.
Yes,
this
second
is a
one
symptom,
is a symptom.
of course.
Symptom.
But,
it is a symptom.
Yes, but dehydration, for example, the patient can't sometimes
Recognize. Yeah.
recognize this condition, and only doctors can see this. Okay. Well, and if we
just a doubt, raised pulse is also something which a doctor can mostly recognize. Not everyone understands the pulse. So I guess it's a sign.
Okay, yes. It depends on the situation, of course, yeah. Well, and here we should focus on the question, which diseases the signs and symptoms might relate to in condition A and condition B. So what is disease? The disease it can relate to. these signs.
And common cold.
Common cold, ma'am.
Common cold.
Condition is common cold.
I see.
Common cold or viral
And
illness.
Or a viral infection, because raised temperature is also there.
And it is located where?
In the head.
It is
Head and
Stress can
nose.
also come because headache, etc.
Nasal region.
Yeah, for stress.
So there is also it can be sinusitis. Yes, as far as this is gender.
Yes.
Yes.
Here we have a chat. I see. This is Priyesh. Now, do you want me unmute your microphone, Priyesh? I don't see you.
हाँ भाई बोल.
Well, it's okay. Now, and condition B. If we have a look at condition B, symptoms and signs, what kind of illness is it?
Ma'am, food poisoning. Food poisoning.
Food poisoning, or
Because
maybe
recent
it,
vomiting and diarrhea, it has also dehydration can be caused due to food poisoning. Abdominal pain is also there during that.
any kind of intestinal infection, or
Maybe somewhere in the pancreas or maybe the liver is not functioning properly. That can also cause all of these symptoms.
It can also be gastritis, for example, yes?
gastritis. Yes.
Gastritis is also. Appendicitis is also possible.
So, I mean, I can't do this, Priyesh. I don't see you. Okay. You cannot start your video because the host has disabled it. Okay, let us help Priyesh. So something has gone wrong. Just a minute. No.
Maybe his network is not stable because we are having this from few days in India.
Well, and yes, Priyesh. I didn't ban you, Priyesh, here. So I don't know. Yes, maybe this is about because of the poor just connection. I see, but Priyesh, you also can't see what we are, the slides, the screen, right? Okay, it disappeared. Anyway, you'll have access to the presentation after the class. I'll upload this presentation to Moodle site. Okay, and we go back to the slides and this one. And well, now let us think of the symptoms and signs which are associated And with pneumonia, you would expect to see in a patient with pneumonia. So
Yes.
what kind of, yes, please.
Wheezing, coughing, having fever, pain in the head, and tightness in the chest, breathlessness. These are the main symptoms. And runny nose, of course.
Okay.
Wheezing,
From diarrhea.
maybe
Pneumonia doesn't have diarrhea.
pneumonia में diarrhea.
Okay. So
High fever.
Main is that the patient is not able to catch his breath properly, his or her. And the another symptom important is the fever. Because if we see the symptoms of pneumonia and emphysema, they are almost similar, but only 2 or 3 are different. That is the fever, because in emphysema, the patient doesn't have fever, and in pneumonia, the patient has a high fever. In pneumonia, the
fever.
lungs might be filled with the fluid that causes wheezing.
Okay.
Ma'am, pneumonia contain, it promotes diarrhea also. It promotes nausea, diarrhea, vomiting, aching of muscles, fatigue, shallow breathing, fever, chills, irritated throat, coughing.
I see. Just a very wide scope of symptoms and signs, and doctors
Depending on the stage.
should be very careful about this.
Yes, ma'am. Ma'am, the one main symptom is, ma'am, at the last stage is high blood pressure, or the high, ma'am, we can say heart rate.
Yeah, if it is caught in the early stage, we can treat it nicely.
Okay, so let's move on to our next slide. And this is about using non-technical language when talking to a patient. As a doctor, when you speak to a patient, you need to use non-technical language that the patient understands easily. Let us look at the examples of questions from the case history given here. And the task is to decide which verb means precipitate and which verb means start. In the first question, when do the attacks come on? Come on, what is it? Is it participate?
Start when the
Start.
When did
Represent the time when it starts.
Start, okay. And in the second question, are you aware of anything that triggers the attacks?
Ma'am, precipitate.
Precipitate.
Precipitate the attacks that goes before the attacks. Okay. And so this is these are the examples of non-technical language. And if we have a look at the next slide, here we can see the sentences, and we should replace the words which are given in italics with non-technical words which are given to the right. So they are avoid, admit, have got, prone, do, to come and go, stick to, book, there all the time. And I would like you to look at the word book here. This is a verb, to book. So you should remember this. Now let us have a look at the sentences, and Apeksha, please read the first sentence.
We are going to have to perform a few tests. This can be replaced by do. We are going to perform a few tests.
To do a few tests.
We are going to do a few tests, yes.
Okay. So Misha, please.
She is suffering from a very bad bout of flu. She's I think prone from a very bad bout of flu.
Any other words that can be used instead of suffering?
Or she has
Yes.
has or have got a very
has
bad
got-
bout.
Yes, she has got a bad flu.
Bad
Okay.
bout of.
So the next is for Nivas, please. Nivas, are you with us? No. Vandana?
Yes, ma'am. it might be a good idea to refrain from fatty foods for a while. So we can use avoid. It might
Yes,
it might be a good idea to avoid fatty foods for a while.
exactly. Well, Priyesh is struggling with problems. Okay. Yada Faraghan is also absent. Ujjwal, Sayonika, Rohit. Rohit, also minus. So, Ritik,
Yes, ma'am. He is susceptible to many minor illness. It can be replaced by prone. He is prone to many minor illnesses.
Okay, great. So the next is for Moht Shoyab.
Yes, ma'am.
Yes, read it, please.
The sentence is you said the cough is intermittent, and we can replace it by
All the time.
By what? Sorry.
the cough is. It's ma'am.
There.
We can use.
All the time. They're all the
Oh,
time.
yeah, ma'am. There all the time. Ma'am, you said the cough is there all the time.
No, it's not all the time.
Come and go.
It's yes, it comes and goes.
Comes and goes.
Comes and
You
goes.
said the cough is to come and.
You said the cough.
You said the cough to come and go.
No, two. If we say this is the reported speech, we need to use the past form of come and go. Yes, you said the cough came and went.
Go.
And went.
Yes, ma'am.
Okay. And so number 6 is for Aman.
Yes, ma'am. Ma'am, your cough is there all the time.
Yes, you're right. There all the time. Okay. And the next is for Apeksha.
It's difficult to adhere to any kind of life changes. It's difficult to adjust to any kind of life changes. Maybe adjust.
It's difficult to stick to. Yes.
Stick to or maybe adjust. Yeah.
Okay. Misha, please.
You won't have to be hospitalized. It can be you won't have to be admitted.
Admitted. Yeah. Admitted. Okay. And the last one is for Niva, for for Vandana. Vandana?
Yes, ma'am. You are scheduled to see the nurse in the allergy clinic next Tuesday. You are
Admitted.
no, it can't be admitted. It
booked.
has to be booked, related to book.
Yeah, booked to see.
You are booked to see the nurse in the allergy clinic next Tuesday.
Okay, thank you. So somebody just wants. Priyesh, can you hear us, Priyesh? Can you speak? I'm sorry, we can't hear you. That is why we don't ask you. You can hear. At least you can hear us. You can't speak. I'm so sorry. I can do nothing with this. Well, let's move to another slide. And so here we need to role play a situation between a doctor and a patient. We should use the phrases which are given here to make questions with the non-technical words. Take turns role playing a patient with flu or a cough, using the phrases like when is there, do you, does it, and so on. Examples are sentences are questions with about cough. Yes. Are you prone to? Are you booked to see somebody? Do you find it difficult to stick to medication? Does your cough come and go? Have you ever had? And you should also remember the Socrates model. So the questions, not only these questions, but also the other questions when you you need to ask when you talk to a patient. So who would like to be a patient and a doctor? Let us listen to Ritik will be a doctor, and Shuaib, you'll be a patient. Okay? Start,
Okay,
please.
ma'am. Okay.
Okay, ma'am.
Mhm.
When is your pain start?
In morning.
Is there any difficulty in breathing?
Yes.
Do you feel any kind of illness?
Yes, I feel pain very badly in my chest.
Did you examine yesterday in our clinic?
No.
Have you ever faced such kind of situations ever before?
No, never.
Are you going to book our next schedule in our clinic?
Yes, of course.
Yes, ma'am. It's
Okay. Okay. Yes, you are on the right way. You just use very simple, just words, for, and the patient understands you very well. Well, and some more information. I don't mute you, Priyesh. I do nothing with your just here. I don't click on the screen even. Let's hope for the best, and just I mean, maybe next session everything will be okay. Okay, and so we are going to listen to some the questions that this is the last part of the conversation between Dr. Dixon and Mr. Bloomfield, when he asked some questions about the general history. And we should listen to the questions the doctor asks about appetite, bowels, waterworks, and sleeping. And we should pay attention to the form the questions are asked in. Now, let's get started, and you say if you hear or not.
Listening 3.
Here,
Do you hear?
yes.
Yes, okay.
Yes, ma'am.
Listening 3. Okay. Do you smoke?
No,
You drink?
just socially. Maybe a couple of beers a week, nothing more than that.
Is your appetite okay?
Yes, I never seem to have any problems on that score.
Bowels okay?
Yes,
Waterworks okay?
yes,
Sleeping okay?
yes,
General health okay otherwise?
yes.
I think we'd better have a look at you. Could you just pop behind the screen and...
So what is the doctor's question about appetite?
Is
Is your appetite okay?
Appetite, okay, yes.
Bowels.
Yes.
your bowel movement okay?
Bowels
Bowels
okay. Waterworks
Sleep,
okay.
waterworks okay. And your
Sleep
sleep
okay.
Bowels okay, waterworks
Waterworks
okay,
okay.
sleeping is also okay.
Sleeping is
General health is
I
also
see.
okay.
I see. I mean that in the conversation, of course, we do not need to use all these long verb forms. Correct. Use the correct forms of the verbs because when the doctor starts asking questions, is your appetite okay? So this is the correct form of the question, and then he follows the same pattern, and he doesn't need to use any auxiliaries in the next questions.
Listening 3.
And so the same is here. Let us have a look at the questions and let us expand them, make them longer. Like in the example, you've been off work at all? It means, have you been off at work at all? So who can read these? Mock Schwab.
Yes, ma'am. Yes,
You
ma'am.
read all of them, please.
Yes, ma'am. You eat well?
I mean, will you
Ma'am, who answer?
expand all the questions?
Okay. You eat well. Have you been eat well? And your appetite okay? Have your appetite okay?
So,
You sleeping
is your appetite okay?
is your sorry is
You
your
need the
appetite
verb.
okay?
Mhm.
Yes, ma'am. Yes, ma'am. You sleeping okay? Is your sleeping okay? You passing water a lot? Have you passing water a lot?
If you
Your
say
periods
have
okay?
it, have passing, what kind of form is
Have
it?
passing.
It's a wrong form. If you want to use the present perfect continuous,
Have
you
been
been.
passing water a lot.
Have you been passing?
Have you been passing water a lot? Your periods okay? Is your periods okay?
It's plural
Had
form.
any
Periods, plural. Not only are your periods okay?
are your periods okay? Yes, ma'am. Had any diarrhea? Have have you been any diarrhea?
Have you had?
No, no. Have you had any diarrhea? Lost any weight? Have you lost any weight? And been living there long? Have you been living there long?
Okay.
Yes.
So this is, I mean, even in the short sentences, you need to remember the correct form of the structure of the sentence and form of the verbs. Well, and now let us have a look. What is happening to Priyesh? No.
Ma'am, I'm here, ma'am, I'm here.
Let's see. Who?
I joined from another ID. Ma'am, you have restricted my ID by mistake, I think so.
Is Priyesh speaking? Yes,
Yes,
I
ma'am.
see you. Welcome back. Okay, so we are going to read some information about social problems, because when doctor deals with his patients, so he needs to understand the social situation the patient lives in. And so here, if we look at the pictures here, we should decide which social problems these people face, which social problems the pictures illustrate. About the first picture, A.
I'm homeless.
Homeless.
Okay, B picture.
Ma'am, it is
Congested area,
Congested area, congested home.
congestion.
It's maybe
A
poverty.
small home, having lots of people.
Poverty, so lack of space, yes, in the house.
Don't have all the resources to get a bigger house and
Well, picture C.
Okay, bad health.
Ma'am, a teen is like
Teenage
consuming a
smoke.
smoke.
Yes, smoking even in face of children.
Yes.
Okay.
Yeah.
And the last one is what is it about?
Overeating.
Obesity.
obesity.
Obesity. Eating. What kind of food are they eating?
Junk food.
Junk
Junk
food.
food.
Junking.
Nice. Okay.
Yeah.
So we are aware of these problems, and so before we start reading, let us pay attention to some words. Just focus on the meaning of some words from the reading task. Deprivation means poverty here in this context. Factors, the same as causes. Incident equals occurrence. So the next is plateau. In this context, this is level. Pronounced like the same as evident. And there is information about social classes 1 and 2. So this is the classification which is used when we speak about population in research, for research purposes. The 2 highest social classes. So I mean, class 1, the class which is very high income. So we should say. Well, and here we have, this is the beginning of the article. We are going to read and to think about this. And let us listen to Priyesh. Will you start reading, please? Priyesh?
Yes, ma'am. Ma'am, I have to read this abstract.
Yes.
Social deprivation is associated with death from all causes. The most pronounced effect is with circulatory and other smoking-related diseases. A similar trend is seen with infant mortality, mobility, and chronic illness, particularly musculoskeletal, cardiovascular, and respiratory conditions, and teenage pregnancy.
Mhm. Is everything clear in this paragraph?
Yes, ma'am.
Well, I would like you to comment on the meaning of mortality. What does it mean?
But mortality is
Ma'am,
death
birth
rate.
rate. Birth rate.
Death rate.
Sorry, death rate.
And
Death
Ma'am,
rate.
mortality.
morbidity?
Ma'am, morbidity from chronic illness is some sort of immunization from chronic diseases. I mean,
Morbidity is the rate of illnesses, right?
actually infections from chronic diseases. It means the sentence means that a number of infections from the chronic diseases.
Okay, number of infections. Okay, and if we move to the next slide, Sayonika, have you joined us?
Yes, ma'am.
So please read this paragraph.
This is not a new problem, nor one unique to the UK. It may partially be due to smoking and eating habits, but this disparity was in evidence 8 years ago when those of social classes 1 and 2 were more likely to smoke, eat foods high in saturated fats, and take less exercises. Disparity in health is closely related to income. In the UK, and proportion of the population is now living on less than 50% of average income than 20 years ago. The mortality gap has grown proportionately.
And this arrow that shows that points up
Increasing the
Increase.
proportion of
and
population.
increased proportion of the population. Okay, and so as for the words which I used here, let us focus on disparity was poverty and evidence. What does it stand for? Evidence. What does it mean?
Facts, proof. Facts.
Okay, proof. And there is the phrase high saturated fats. Saturated fats. Can you comment on the meaning of this phrase?
They are not easily to break down.
It can infallibly. They cause obsessive emotion.
They take time.
Okay, good. And well, and let us income. So average income. What does it mean average here?
Majority
Approximately.
of
Approximately.
Okay, approximate where the majority have the same level of income. Yes, okay.
Yes, ma'am.
And let us move to the next slide and let us listen to Ritik.
Yes, ma'am. This is an impact of journal practice. There is an high incidence of illness and requirement for primary care team services and the increase of the use of hours and A&E services amongst deprived communities.
So these arrows that point up,
they are
increase.
Yes, ma'am. They are increasing,
Increase.
and illness is increasing.
This
Ma'am, the illness
going
goes
forward.
Going forward.
Going forward towards illness.
Yes, leads to
yes, towards leads.
increased requirement. And these letters A and E services, what do they stand for? A and D services. Who remembers? A and D services means accident and
accident
and
and emergency.
emergency.
Accident and emergency.
Accident and emergency.
Okay. Okay,
Ma'am,
and
actually, we have OPs for this. That's why we got
And-
confused. I mean,
who is speaking?
ma'am, I was speaking. Priyesh.
Yes.
What about who? What's your name? I don't see the face.
Ma'am, you don't. Ma'am, Priyesh. Priyesh.
I see Priyesh. Mhm.
Yes, ma'am.
Okay. So now let us listen to Shuai.
Yes, ma'am.
So read it, please.
Other factors which have an effect are homelessness, sleeping rough, employment and unemployment, divorce and immigration status. The adverse effects of living in temporary accommodation are well documented. For example, adults have an increased incidence of depression than people of similar social stand in their own homes.
Mhm. Okay. So
Ma'am, in the first line factor, ma'am, represent the cause, and we can say, ma'am.
So, do we understand everything?
Yes, ma'am.
Divorce, for example.
Yes, ma'am.
Okay, this is, what is it?
Ma'am, incidence, ma'am, in the last headline, incidence show, ma'am, occurrence. Incidence mean occurrence. Increase occurrence of depression.
Okay, I see. Okay. Now, and the next part, let us listen to Aman. Aman? Well, unfortunately, just we have less than 1 minute. The home task, I'll send this presentation to Moodle site, and also I've uploaded the instructions. The home task will be week 3 of English for Healthcare course. So if you have any
Ma'am, we have to submit it on Universe system. The week
no, only on Moodle site. Yes.
Okay.
Okay, take care of yourself. See you in a week. Bye bye.
Yeah, ma'am. Bye bye.
Bye, ma'am.
Bye.
Bye bye.
Hi, ma'am. Have a nice